Hi, I'm Elaine Brewster, and welcome to Aspects of Energy today. This is a very, very special program where we have some representatives from the Immune Therapy Center in Mexico. Now we've got Carlos Alvarez. Well, let me say that the founder of it is Carlos Bautista, and he's the picture that I put on the flyer that I sent out to many of you. I sent that out last Sunday. But today we have two representatives, Carlos Alvarez, and tell us which one is which here.
Yes, hi, I'm Carlos Alvarez. I'm the Director of Development here at Community Therapy Center, ITC. I've been working with the founder, Dr. Bautista, for about 10 years now. And as you said, Elaine, well, first, thank you for having us in your program. I'm very happy to be here with all you guys. And as you mentioned, the Dr. Bautista founded Immunity Therapy Center because when he was studying medicine, his father got cancer, got lung cancer. So, I mean, he didn't like what he saw on the conventional treatment. So he devoted his life on researching and practice with more natural, less invasive medicine. So that's how he has been doing for more than 25 years. And we have a very, very comprehensive program where we combine more than 25 different therapies. And these are the therapies that during all these years, Dr. Bautista has found are giving him the best results. Okay, so I believe we have the most comprehensive program here. And I'm here with Dr. Alvarez. Dr. Alvarez is the Assistant Medical Director here at the center. He has been working very close with Dr. Bautista for more than, I believe, 7 years now. And so he's very knowledgeable. He understands all the treatments. So he can give you a little bit more like a big picture about the treatments and the different pillars that we use to treat these diseases. Okay, so I'm introducing Dr. Alvarez. Dr. Alvarez, if you can give us, yes, I mean, a little bit of your background and explain you more about the different protocols that we use here.
Hello, everybody. Dr. David Alvarez here from Dr. Bautista's Immunity Therapy Center. As Carlos Alvarez, our patient coordinator, mentioned, I've been working closely with Dr. Bautista for about 7 years. It's going to be 8 years now. I'm a licensed physician here in Mexico. I studied here in a private university here in Tijuana. And well, over the years, I've done some training on the alternative cancerous field, along with the metabolic aspect of the disease, either traveling and getting a lot of research done here with Dr. Bautista. Dr. Bautista is my mentor. I've learned a lot from him. And well, I believe what I've learned here is that there are several options to fight this disease, cancer. It's a very complex disease. And it's smarter to fight this from all different angles. It's important to work on the immune system's ability to heal. Our body has the ability to heal. And well, it's important to work with our patients in many aspects, not just the standard traditional way, which I'm not against, but there are options out there, right? And here with us, there's a big protocol in place to help our patients to get back on their path to recovery. We can address different things starting from nutrition. That's one of our main, I would say, one of our main treatments. Dr. Bautista, besides the cancer background, has a master's degree on nutrition, so he customized, well, everything, but he also focuses a lot On the diet, basically, when it comes to diet, we have 3 important rules. Well, 4, no sugar, obviously. It's well known that cancer cells feed on glucose to perform all of the regular functions, reproduce, grow, spread, everything that a cancer cell can do. No red meat and dairy products, but something, the 4th thing would be obviously no alcohol, right? So Dr. Bautista has his low glycemic index diet, which is something easy to follow. But it's important to understand that most of our patients, not all, I don't know, 9 out of 10 patients would come here with us after being treated with standard treatments like chemo, radiation, or surgery. So metabolically, they're not in the best shape or the ideal shape. So it's important to work on nutrition, basically to have our patients in the best metabolic conditions so they can actually be strong, you know, for the treatment. Because in the therapies or the treatment plan, we combine up to 25 treatments. We're incorporating some new therapies in here. So basically, patients have to be in a good metabolic shape, right? They have to be in good conditions. Overall, we focus a lot on emotions. We focus a lot on the mental state of the patient. One of my teachers from med school mentioned something to me. He's actually an oncologist, but more on the functional side. But what he said is that there's nothing more aggressive on our immune system like stress. You know, so it's important to address that. Most of our patients, as I mentioned, there's an emotional background behind or prior of developing this disease. Stress, anxiety, depression, many other psychological factors can contribute to reduce our immune response. We actually have a treatment called VRM, which stands for virtual reality meditation, that it actually started as a clinical trial, as a clinical study with a big hospital back in the States. And what we want to evaluate is the impact that we'll have to help the patient to visualize his healing on the prognosis. You know, we have a treatment, the VRM, which is virtual reality meditation, where it's a special equipment, but basically the patient is visualizing his healing, his T cells and his B cells recognizing the cancer, and you know it helps a lot, you know, to have a patient in a good mental state and work. And you know, it's important to work on that aspect. There are several. We have the part of different what we call immune boosting treatments. There's a variety of therapies. We have things like the autologous stem cell treatment. We work with the GCMAF, which is a macrophage activating factor. We work with dendritic cells, for example, which basically will increase the number of B cells and T cells. We work with the specific transfer factor treatment. Those are some of the non-invasive immune boosting treatments that we work. There are some of them that require us to be a little bit more invasive, like the LAK, leukocytes activated by interleukin type 2, where we take a sample of bone marrow. Prior to that, we stimulate the bone marrow with substances like Neuprogen or interleukin type 2 or interleukin type 15 to increase the number of B cells, T cells, natural killer cells, and then we infuse them back to the patient's body to create an immune response. There's a lot of information about this treatment that I won't get into details. We have other things like the specific killer cell vaccine, which is creating a vaccine out of an actual tumor tissue. And we recently incorporated another treatment called mononuclear cell activation, which is basically a device that initially was used. It's actually used in the cancer field, more on the hematology side. And initially, this machine was developed to help to reduce the number of white blood cells in patients with leukemia that were not responding well to the standard lines of treatment, which is the chemotherapy. But well, our hematologist has been working with this device, and it's a device that can also help us to separate different type of white blood cells, like mononuclear cells, natural killer cells, B cells, T cells, dendritic cells. They all go, it's a circuit, and then it goes into a bag, overstimulated obviously with certain substances, and then they go back into your bloodstream. It's a strong immune response. It's all about working on boosting the immune system to recognize cancer, and that's the future of oncology. That's where it's going forwards, you know, to be less invasive, and it's well known, it's no secret that immunotherapy is on the rise. So we're working on that. We have some other treatments, local alternative therapies like hyperthermia, which are heat treatments. We work with treatments that can increase oxygenation or create an alkaline pH or induce an oxidative environment. I mean, I could talk all day about this, but the important thing here is to let you know that there are options, and you know, I believe we're the best center in Mexico to treat cancer and get our patients, you know, help our patients to turn things around. Most of our patients, they've been through all 1, 2, 3 lines of treatment, and it's either a case scenario where they come to us where they don't have options, or we have some patients that are, let's say, virgin to treatment. So it's a different, you know, story. But just to put it this way, we basically have the cases that nobody else wants to treat because of how complex it can be. So, well, this is just a small synopsis of what we do. Carlos will tell you a little more.
Yes, Elaine and everybody, I mean, if you have, I mean, specific questions about what we do, if you wanted to ask about certain protocol that we have here available, I mean, that will be a good way to you get more information about it. I send you, Elaine, the list of everything that we do here. You know, as Dr. Alvarez says, I mean, we have different pillars. You know, one is stimulate, train the immune system so it can recognize the disease and help us in the healing process. Okay, we have other alternative therapies like the RIFE, like the sonodynamic, we have Halo. So this is a special equipment. I mean, this is high technology that we have here that we use in order to kill those cancer cells. We can add to that all the intravenous treatments that we have with high doses of vitamin C and minerals, and those go directly to the bloodstream in order to be more efficient. So the success of the program is the combination of all the treatments working at the same time, right? When the patient comes to the center, Dr. Bautista and the team of doctors evaluate case by case, and they tailor the program according to that specific situation. Okay? So it's the combination of everything that gives us the success that we have.
Okay, so you can we find on the site what those different things are, many of which you've delineated here?
Yes, you could see on the website it's just a second, please. Okay, yeah. You can find them in our website, the list of different treatments, a little explanation on how they work. It's a lot of information to digest. Good information, but it's a lot.
What you're saying here helps us a lot. Can you put the website on the chat for us so that people can see that? And then while you're doing that, we've got a question which is good. In this process and the work that you've done, can you now share some ideas on how to prevent cancer?
That's a very good question. Look, there are different conditions or situations that could trigger cancer cells to grow. Genetic factors, you know, family history of cancer in the patients, parents, like first-line family members, parents, brothers, sisters, grandparents. So if you have a history of cancer in your family, it's always important to stay in top of things. Don't put off your routine checkups, right? So prevention is the key. There are environmental factors. There are some conditions that are related with being exposed to radiation or being exposed to pesticides, for example. Nutrition is very important. We are what we eat. And most of the patients, let's talk about a case of a patient, I don't know, 70 years. Most likely this cancer, I mean, yeah, it showed right now, but it started to develop years ago. And it's because of the type of food that we're eating, that it contains hormones, pesticides, it contains a lot of chemics that we're not aware. And obviously for business purposes, they won't write down on the stuff, right? So nutrition, genetic factors, environmental factors, stress, manage your emotions, that's also important. Anger, anxiety, stress, those things, you know, they definitely could trigger or could increase your risk of developing cancer. So that's what I can tell you. It's a very commonly asked question. I think it's a combination of several factors. Things that you can do to prevent this, obviously exercising daily, at least 30 minutes, following a low glycemic index diet, drinking a lot of water, having your regular screenings, you know, colonoscopy after 50, your ultrasounds or thermograms or mammograms for patients that believe in that. You need to talk to your doctor about the best diagnostic plan. If you have a history of breast cancer, for example, in the family. And well, I mean, cancer cells, they normally grow in very low oxygen levels. So exercise and, you know, doing certain therapies like ozone therapies or vitamin infusions could be helpful, you know, but prevention is the key, and you know, try to have your screenings, right?
Thank you. So he mentioned a low glycemic diet. So, you know, and what they're doing there is no sugar. How many patients do you have there at the center? Do they stay at the center? And in order for Dr. Bautista to have continued this for 25 years, he has to have had a lot of success. Do you have any percentages on, you know, if someone wanted to go there, that you could say, yes, you know, X percentage of people really have been helped?
Yes, I mean, success rate, I mean, depends on many factors that are evaluated once the patient is here, you know, like the age of the patient, where the cancer is located, if it has metastasized. I'm sorry, let me put the, I don't know, probably because the connection is a little bit slow here, so.
But we like seeing your faces.
Yes. So I mean, how the patient has been treated before. So there's different factors. I mean, it's hard to say, you know what, I mean, this is the success rate because each person is different, you know. also, I mean, we have to count, I mean, how committed is the patient to follow the doctor's instructions, you know? I mean, there's people that are willing to pay the price to change their lifestyle, but there's other people that come to here, but they continue with the same, I mean.
Well, yes, I was gonna ask you, you know, you talk about this lifestyle with no red meat, no sugar, no alcohol. You know, how easy is that for some people to say, yes, I want to get rid of my cancer, I'm going to do it. And then others say, no, I'll take what I've got.
Well, it's as Carlos is mentioning, you know, the commitment to the treatment is important. I mean, I've had cases with patients with lung cancer that are smoking outside of the clinic, or that they come drunk to treatment. So obviously the prognosis, you know, will change. I know it's hard, you know, it's a strict regimen when it comes to diet, but definitely following the right protocol could help us could help the patient to accomplish a lot. So you have to be committed. You need to understand that once you're, I mean, the treatment, it's not done once you're out of the clinic for the 3 weeks. I mean, you need to continue, as Carlos mentioned, changing your lifestyle, managing your diet, managing stress, taking some supplements, having follow-up. There's a variety of things, you know, that you need to continue, continue on your path to recovery.
Did you say 3 weeks is a typical time to be there?
Yeah, it goes, the minimum duration is 3 weeks, okay? It's what Dr. Bautista, I mean, asked the patient to commit with him in order to create an impact in the patient's health, okay? When you ask about success, I mean, I've been here 10 years with Dr. Bautista, and I can see that for every 10 patients, 7 respond very, very positive, okay? But as Dr. Alvarez mentioned, I mean, I put it this way, I mean, we put 50%, the patient has to put the other 50%, you know? I mean, they need to follow strictly the doctor's orders in order to get the best results.
Well, and that's maybe something that you help people to understand there. People don't get cancer. You know, they don't catch cancer. Oh dear, this thing suddenly happened. Like you said, it's something that happens. We don't want it. We don't do it purposely. But I mean, we don't eat food that has pesticides and things like that purposely, but it happens in our society. And then that stuff stays in our body and, you know, and then can create things. So yes, people, number one, I think they need to realize that they are part of this whole process. You don't just get to come in and say, I'm a hot dog on the table, do something with me, Dr. Bautista.
Mm-hmm. Yes. Yeah, it's a journey, you know. I mean, when you have that kind of disease, it's a journey. I mean, it's not something that it's going to go away, I mean, in a few days, you know, because as Dr. David Alvarez mentioned, I mean, it takes time to develop. So, I mean, we need time to treat you. I mean, but even with advanced cases, I'm sorry, we are being able to put people on remission, you know, but each people responds different, and we need time, and people has to come and try these different protocols and see how they respond to them, right? Here at the center, we run evaluations every week, and we give an update to the patient because the doctors here are assigned. I mean, each patient is assigned to a doctor and a nurse here. So the doctor can follow up every day and see how the patient is responding to the different protocols. And Dr. Bautista oversees everything. That's the difference with other centers. I mean, Dr. Bautista is here all the time, and every morning he has a meeting with his team to go over each patient and see how they're responding. And so if he needs to tweak the program, in order for the patient to obtain the best results, he will do it. You know?
How many patients can you accommodate?
We can accommodate up to 40 patients a month here. Normally we are around the 30th, and about 30 patients every month at the moment. And the reason is because, I mean, we don't want it to have, I don't know, 50, 60 patients. I mean, Dr. Bautista, all these years wants to give a very personalized attention. So, I mean, each patient has the time they require.
Right. Are you in Tijuana?
Yes, we are in Tijuana, Mexico. We are just 5 minutes from the Mexico and the U.S. border, crossing from California, San Diego, California. And well, you know, the main reason we have to operate here in Mexico is because we can use many protocols that are still not available in the U.S. And that's the main reason we are here.
But what kind of, do you get any resistance? I mean, I know you have to be careful with your website. Do you get any resistance from official entities?
No, because I mean, as I said, we are here in Mexico. Everything that we do has been evaluated by the health department in Mexico, and we have license. So I mean, that's why there's no problem. I mean, there's people and that have questions that they come from another countries. Once they understand how this medicine works, they understand. And as I said, I've been here for many years, and I've noticed that more and more people lately understand and are more interested in this kind of medicine because they found conventional methods too invasive to the body, to the immune system.
Can you go back to the red meat? Is it the hormones in it? Why is red meat not something that Dr. Bautista would want people to have?
Well, red meat right now, it's if you look on the World Health Organization's webpage, red meat is now classified as, they put it on the same risk factor zone as tobacco. And it's because of what they, we don't know how, we go to a restaurant and they will give us this beautiful porterhouse steak, but we don't know what it has really, so there's a lot of hormones that they put on the animals to make them grow and to make this steaks look beautiful. So most likely it's because of that. But like I said, if you do some research and look on the World Health Organization webpage, you're gonna see that they have classified red meat with to be a carcinogenic substance, and it's basically as dangerous as smoking tobacco. So that's what I can tell you.
Wow. What about pork?
Well, it would be considered to be also a type of meat. Here, the diet will contain a lot of vegetables, a lot of greens, and like I said, low glycemic index. But the only type of meat that our patients would get is either salmon, fish, sometimes organic chicken or turkey, but no pork, no red meat, no nothing like that.
Okay. Oh, sorry, I just had a good question and it just left me. Is the same true for collagen protein form? Oh, from cows.
Can you repeat the question, Elaine?
I'm not sure. Kim, is that your question? Let's see if she can unmute.
Yeah, it's my question because there's all these collagen peptides that people are doing, to help elasticity of their skin and help with their joints. But thought is they keep calling it, grass-fed, but is the same true for red meat as it is for the red meat they derive these collagen and other products to get the proteins from it?
Most likely, but we could, we have an expert on nutrition. His name is Nicolas, or we have Mariana. I think he could, if you can schedule another conference, he can talk 100% about the diet situation, and we can get into deeper details of that. But most likely, it's a similar situation.
I'm going to.
Can it go through the milk?
Sorry?
Can it go through the milk? Not the meat, but
can it go through the milk of the cow?
Can it go through the milk of the cow? I'm not, well, it's a tough question. Honestly, I don't have an answer for that. I think that's more a question for our nutritionist. I think it's important to schedule a meeting with him.
I'm going to include the info at Immunity Therapy Center email address. So if you have any questions about nutrition, I definitely can pass that to our nutrition. And we have two nutritionists here at the center, Nicolas Caballero and Melissa Bolaños. Both have been working with us for many years as well. And they are the ones that when the patient comes, they evaluate the how the patient diet is, and they give the best recommendations for the patient. And they are the ones also that pass the menu to our kitchen, so our kitchen crew can prepare the healthy meals for the patients. So, I mean, if you have any questions about nutrition, definitely we can pass those questions to them and send you back the answer. I'm going to put that right now in the chat.
All right, thank you. And I told everyone we'd be a half hour, and that's about where we are. We have learned so much. I personally am so grateful that you are there. Your center is very, very similar to the center that my husband went to, where there were non-invasive methods or worked simultaneously, saying that cancer is a complex thing and working on it with, with the emotions and how you're feeling and how you react to life rather than just treating it as a physical entity. So thank you, both of you and Dr. Bautista and your nutritionist. Thank you for your good work, and thank you all for being on today. I'll tell you one thing that can raise our energy for all of us is to go find some people to smile at. So let's all go and smile at some people, and that'll raise their energy and that'll raise ours too. Thank you so much.
Thank you, Elaine, for having me.
Thanks so much. Bye-bye.
Have a blessed day.